Now that you mentioned bone, let's go there. So, we talked about 5 grams, let's say somewhere like, you said 1 gram per kg, like 1 gram per kilogram of a body weight is usually appropriate, taking into account size and sex and all of that. What if someone, and, maybe the loading phase might be appropriate for someone who's an Olympic athlete or really, concerned about performance. What about the opposite end of the spectrum where we might have someone who's osteopenic or sarcopenic? Would the loading phase be applicable to that population?
Yeah, I would recommend no, because some of the adverse effects that can occur. Now, you
Okay.
could have a counter argument to something I talked about earlier, where as we get older, we theorize that you may need more creatine, and the loading phase could be a really great way to really sort of give them a boost. I'm fine at either, but when we do clinical trials with adults 50 and above, when we do the relative loading or relative dosing period without a loading phase, we don't get any adverse effects, and it is effective. And all the studies that have shown benefits on bone, the interesting thing here is there was no loading phase, and we gave zero point 0.1 all the way up to 0.14 grams, so about 8 to 11 grams a day for consecutively for up to 2 years. And it had some, not a lot, but some bone benefits in postmenopausal females. It sort of decreased the rate of bone mineral loss in the hip, which is really important, especially for both of us being in Canada.
Yep.
Icy roads coming up. If you fall and suffer a hip fracture, it could be catastrophic. It was interesting, below the knee, not only did it improve muscle density, but it also improved bone area. So think of those muscles that are activated when you fall or when you're jogging or running. So there is some evidence that creatine and exercise, I can't stress this enough, creatine without exercise doesn't really do anything. You need to have the exercise there. There's a lot of studies that don't show a benefit with creatine on bone. And I think for two reasons: that we don't think the dose was high enough, or the duration of the study was long enough to see some significant effects on bone. But when you look at the ones that are a year long and 2 years long in a large cohort of postmenopausal females, the lowest dose that has been shown to be effective is about 8 grams. So now you're like, whoa, I thought muscle was, yeah, muscle can be 3 to 5 grams. Bone takes a little bit more. And then we'll talk about the brain as well. So I'm like you, I take 10 grams religiously a day. If I'm traveling overseas, I'm very susceptible to jet lag, which we'll talk about. I take 20 grams in that week. So I load, even though I might have the most creatine in my cells on the planet. I've been taking creatine for 2 straight decades. I still take a loading phase before I travel to Europe. I find it really helps decrease the fogginess from jet lag.
Well, that's really cool. And I've pulled some of your studies for
Okay.
discussion today around bone specifically because this is for perimenopausal
Mhm.
women. I cannot tell you how many x-rays I have looked at that I see a 35-year-old or 40 osteopenic already, so she has like her bones are gray. So it's like you don't
Yep.
even see the nice cortical bone, the nice white shell and the cancellous bone. You already everything just kind of shades of gray, right? Not making any reference to the movie. So let's
Okay.
so let's talk a little bit about some of these studies that you've looked at, and we'll make sure that these are linked in the show notes. I've highlighted a couple of your findings, particularly with bone. Creatine supplementation decreased the urinary excretion of type 1 collagen, also increased whole body bone mineral density and lumbar spine bone mineral density. Okay, so this was done in young boys. And then another one to your point around resistance training. So during supervised resistance training, 8 whole body machine exercises in healthy older males decreased bone resorption by 30% compared to non-significant 6% reduction in the placebo group. So let's talk a little bit about bone resorption. So we've talked a lot on the show. My Betties are familiar with the term osteoblast and osteoclast. These are bone builders and bone breakdown, like the bone builders that build up the bone, and then the clasts break it down, bone resorption. Talk about how creatine can act as a substrate or fuel source, let's say, for the bone builders, these osteoblastic cells in the skeleton.
Yeah, it was a study that was by accident, kind of. We got bored of muscle, and then a great researcher out of Switzerland said, "Well, bone has transports for creatine just like everything else, and let's put bone building cells in the presence of creatine," and it became activated, very energized. And then immediately the theory was, wow, if we take this to a healthy human population, if our osteoblast cells are more energized, could they lay down more calcium? Could they lay down more phosphate salts in the matrix of the bone?
Mm.
And could the bone actually get an increase in deposition? And then we started to think, wow, what if it has anti-catabolic effects or anti-resorptive effects? And when you look at type 1 collagen, it's a very easy marker to look at. about 30 to 40%, depending on the individual, or collagen is the most abundant protein, it actually showed that you got a reduction in this marker of bone resorption. So for your listeners, very similar to a bisphosphonate, but obviously it's a non-pharmacological intervention. And there's been a few studies to replicate this, that creatine with exercise seems to reduce measures of bone resorption. And then if you put them together, maybe these osteoblasts get more energized. Osteoblasts release a decoy in our cells called osteoprotogerin, which inhibits osteoclasts. So which population would benefit from having an improvement potentially in osteoblast activity and a decrease in resorption? Well, it's anybody on the planet, but primarily more biological females. And we focus on postmenopausal females due to the cessation of estrogen. And that's why that population was sort of targeted. But the few studies that we started with were in healthy males, and even males had a beneficial effect from reducing NTL peptides as well, or bone resorption. And that's now been shown in young and older males as well. So it's nice that we have males and females responding from a positive aspect with creatine. Again, there's other studies that don't show the effect, but I think the methodology or differences between the studies has to be considered. But there is evidence to suggest that creatine and exercise can have some muscle preservation effects, if you will, as well as decreasing bone resorption.
Well, in both cases, it's anti-catabolic, right? So, but with the so with the muscle, it's anti-catabolic. It looks like it's the same in terms of like fueling the right bone cell, right? It's like fueling the osteoblasts and sort of inhibiting the osteoclasts.
And I really like your segue. When you talked about the young boys, that study was done at McMaster with Mark Tarnopolsky, and they looked at Duchenne muscular dystrophy, which is highlighted by many facets. But one of the big things is a decrease in muscle and bone mineral. And it was the only study to show that in a clinical or disease state population, activity and creatine can have some bone building effects, which I think has enormous application. Those studies often get overlooked as justification of why we're trying to do it. So maybe when you take creatine in healthy humans, adequate diet, you may not notice any big bone effects, but in clinical populations, the question still remains. And that's why I'm really intrigued of taking an osteopenic population and osteoporotic and even frailty. Maybe this lifestyle intervention of exercise and or creatine can have some more favorable effects. And I see that as being a focal point for the next decade.
Yeah, and unlike the bisphosphonates, you can take it longer for 5 years, and you're not going to increase your risk of fracture, which is what happens when you're on some of these long-term drugs as well.